Good morning, everyone.
Good
Good
morning.
morning, Eliza. Good morning, everyone.
Hopefully, y'all can hear me okay. I'm taking this call from Panera. I've got a doctor's appointment around the corner. So I was like, let me do this as close as possible so I can stay on this call as long as possible. I was not smart. I set this up for 11:30 and I should have set it up for later. How are you all doing? Good.
Doing well. What about you?
Good. Wishing that Thanksgiving mini break was longer than it was, but you know, counting down the days till a holiday break. So,
Yeah, it is
were
nice
any,
around this time of year that things like I look forward to like the slowing down of things a little bit. I realize that that is not the case for everybody, but
yeah,
it is nice, to be able to take a breather.
yes. Did anybody travel for the mini break last week or stay
Only to
put in
Karen,
Durham?
but
Yes, I did.
I thankfully did not. I don't enjoy traveling during Thanksgiving weekend.
Yeah,
no.
yeah.
I was talking to one of my friends who went from here to Atlanta on Wednesday, and she said it took 11 hours. And I'm like, that's like a seven
Oh
and a
my
half hour
gosh.
trip. She said it was just, and it was just almost slow and steady the whole way.
Wow. Yeah,
Um,
that would frustrate me so much.
Yeah, our infrastructure doesn't matter whether it's the highways or the airports. It just does not seem to be big enough to accommodate the travel needs of our country citizens these days.
That's right. That's right. Well, Colin texted me this morning to let me know that he had a power outage at his house, so he may be a few minutes late in getting here. Since he transitioned from one meeting into the office to be on this one. Well, welcome. And
Good morning.
good morning. And Malachi, welcome. It sounds like maybe you need to leave um, from the chat, but welcome anyway. Hi, Sally. Welcome.
Good morning. Thank you.
We're waiting on Sharita and Ebony.
sorry if I keep wincing back and forth. I'm getting the minutes and getting everybody's attendance.
All right, I think you officially have quorum.
Great. Thank you so much, Melissa. Well, welcome everybody. Hey, Sharita. It is December 1st, and I'm calling this exec meeting to order at 10:04. Our agenda got sent a couple days ago, and then Russ followed up with minutes, so hopefully y'all have that in front of you. And Colin will be joining us in the next couple minutes as he's in transition this morning with some internet home issues. So the first item on our agenda is to approve the November exec meetings that Russ sent along, I believe yesterday or the day before. So I'll open the floor for a motion to approve those or considerations for edits from anybody. I'm assuming folks are looking over the notes as we silently wait.
I move that we approve the November minutes.
Thanks, Jonathan. Do we have a second?
I'll second.
Thanks, Russ. Please vote in the chat, yes, no, or abstain to approving the minutes. It looks like our minutes have been approved. Sharita, if you are in the car, feel free to unmute and vocally vote if it's hard for you to do it in the chat. But it looks like
I voted. I thought I voted.
Okay, maybe I just missed it on my end. I'm sorry. I guess I just get confused about how many votes we need to approve. So I was just looking at who from exec team was here. Thanks, Sharita. Alrighty, so our minutes are approved. We can move ahead to our next item, which is to review and approve the recommendation to move a priority item forward from the JAM board. And so I sent this and then I believe resent it. Thanks, Russ, for that reminder. For the minutes for the agenda this meeting, since we did not get to it last meeting. So this is an item that we've been circling around our conversations around the JAM board activity that we completed together. And so I'll just quickly review what was sent in the email to the exec team. Colin and I got together and talked about this, and then there is a small update that I can share that's connected to this recommendation. So when we looked at the cross-section of JAM participant responses and the COC application, one of the major alignments that elevated was the connection of all four of our goals to the section of the COC application, coordinate with housing and healthcare. Participants identified this as an area of improvement, the same as reflected in our COC application score from last year as we received 0 points for this section. This work is highlighted and elevated across several groups in Durham and would be an opportunity to join together capacities and work strategically. There are conversations happening around this coordination across the Bloomberg work that Mayor Lane was heading with Justice Involved Neighbors, the Durham Familiar Faces Initiative, which there's overlap here in this group with that work, and among concerns elevated from providers at discharge locations such as Duke Health and the VA. So this work could elevate and yield impacts that positively support system performance and coordination engagement. The two other COC application sections highlighted on the visual that I shared via email that were two other priority areas on the COC application reflection of what we could work on. And then given the context above, the recommendation that Colin and I are bringing forward is to focus energies on identifying and defining the scope of this problem, partnering with groups that are also working with this defined scope, and continuing to build communications and highlight opportunities for coordination with healthcare providers. So it would really be looking at how can we improve our score in coordinating with housing and healthcare, and thinking about that with alongside other groups that are also connected to that concern, or thinking about those issues as well. The additional piece I can add is I quickly referenced this in our last meeting at the very end. The Sanford School of Public Policy has a spring consulting piece that the students do, and Russ and I worked together to submit an application that would have students looking at what are other places across the country doing in terms of coordination around housing and healthcare, particularly those who have university and university health systems. So we are not sure if they will select that, but that could be a great way to kind of start collecting information around what are other peer institutions doing across the country, and how might that offer information, support, and best practices that we could bring forward in Durham. Lloyd.
Thank you, Madam Chair. Good morning, everyone. Just want to offer some clarification regarding the continuum of care application and the point values.
Sure.
Obviously, we don't know what HUD is going to put into the 2024 NOFO, but the specific point values of 7 points for coordination with housing and 7 points for coordination of healthcare that we didn't get in the 2022 COC application were specifically for contributions towards the projects that were going to be recommended for funding. So HUD wants to see contributions of leverage for specific projects that are recommended for funding. So, for example, we quoting here from the 2023 NOFO, we need a written commitment from a healthcare organization with the value of the commitment and the dates the healthcare resources will be provided. And similarly for housing, HUD wants to see contributions of housing subsidies apart from COC or ESG funded support for those housing subsidies. So it's to add values to specific projects that are recommended for funding. It's not to say, certainly I would wholeheartedly support more efforts to get more coordination of healthcare resources and housing resources for the community, but just in terms of the collaborative application, it specifically refers to support for projects that are recommended to HUD for funding.
Okay, got it. And so it sounds like you identified 2 areas. One is subsidies. What was the other one?
Oh, well, leverage, housing subsidies, and then healthcare resources being leveraged and contributing to the project.
So it might just be that I think our intention was to align it in that way. It might just be that we need to add a little bit more context and specificity. And so if our project is selected as a spring consulting project, I think we'll be able to add those pieces in to make sure there's alignment. The thought was that we could have some students do this work, and the timeline for this would be done in April. There'd be about 100 hours of work that students would put into it. And that could add some capacity for us to get this moving in some direction alongside others also. So thank you for that specificity. I will work on kind of trying to add that to what I've sent. And then Lloyd, if I send it to you, will you just confirm that the language is more clear?
Sure.
And if you've got anything that you could send my way to help me do that, that would be great. Thank you. Russ, did you have your hand up or are you good?
I was just going to say, Lloyd, anything you could send that would give actual examples, because I think
Yeah.
what you said is a little more clear than I've heard previously. And it triggered, I mean, like, I know we're getting $20,000 to $50,000 a year from Duke, depending on the year, that goes towards Williams Square in Andover. But I don't know that it's pretty general. So I don't. There's a part of me is like, we need to know the specific examples of what they think counts, because it may just be a matter of packaging things.
Yeah.
In some cases, I mean, there's growth needed for sure, and we need more clarity on some of on how some of the work that Sally and team do contributes. But it sounds like some of this may simply be a packaging issue, at least at a baseline.
I do agree with you, Russ, that it is, I think, largely packaging, and how we present it to HUD.
And some of this,
application.
I was remembering is like the MOUs was a big piece, right? Is like, rather than it being a grant, it's an MOU. And so I think that's where, particularly for, I can speak for Duke, it's helpful to have a little bit more context as to why and how others are doing it, to kind of direct them toward a new way of, you know, we can still keep doing grants, but how can we incorporate this other piece that is actually, you know, not that different than what we're doing, but is really helpful in terms of how HUD sees it. So I think that's the goal, and incorporating students, I think, always is a thing that Duke really loves to see when they make decisions. So there's some strategy there. So Sherita, I'm seeing some things in the chat from you. I think the first place to start is to make sure that our projects are working with healthcare providers. It's become more challenging since COVID. One, how can we work better together with our partners that provide healthcare to persons who are homeless? And two, once we master doing that, using our assets, and how can we grow these partnerships in a better way? And you agree with Russ. So yeah, it's great to think about what's already happening and how can we formalize that or shift it a little bit so it fits into this format. Any other thoughts or questions? That was, we wanted to bring this forward also to the HSAC, the full HSAC, to kind of tie a bow on some of this Jamboard activity so that folks kind of know, like, hey, this is a priority that came out of this work. Here's how we plan to move it forward. So any additional thoughts, excitement, ready to vote? Hey, Colin. Welcome.
Hey, sorry about that.
No problem. I updated everybody. We're doing our best. It's Friday.
Losing power makes
That's
it very difficult to do much of anything, and delayed the first meeting of the day.
Yeah. And on the day where you wouldn't think you would lose power, but
Exactly.
you know, with all the digging that happens, if you've got fiber, those lines get hit way too often.
Mm-hmm.
So nice haircut. It looks like you got a haircut.
I did.
Good. We are talking about the Jamboard. I just shared with folks what we had discussed, and Lloyd added some really good details that will help us refine kind of the scope a little bit more, to make sure that we're aligning with what HUD wants as we kind of explore possibilities of coordination between housing and healthcare in our COC application. And so we were just opening for more discussion around this before we vote on bringing it forward as the priority that came out of Jamboard for the full HSAC.
Sounds like a plan.
So anything that you want to add, Colin, or others on the call before I open the floor for a vote?
I'm good.
All right. Well, then I'll open the floor for a motion to bring forward coordination of housing and healthcare with the specifics that Lloyd shared today as a recommendation to the full HSAC as a priority item from our Jamboard.
I'm happy to make the motion. However, I think I'm not quite able to word it correctly. So I'm
Yeah.
just going to say, I move that we move forward the the information from data from the JAM board, and with the explanation from Lloyd. This is a terrible motion. I'm sorry.
No, I started it as a terrible
I move that we
motion.
adopt it.
Let's just say the adopt the Jam board priority. How about that?
There we go. Thank you. Thank you. I'm sorry. I'm struggling with that.
No. And I said it really, really long, so I did not set you up for success. It's on me. Do we have a second after Jonathan?
Don't leave me hanging after I struggle.
I forgot I was muted. I'm over here trying to make up the motion or write it up. Let me put it that way. I'll second.
I'll even restate it. I move that we adopt the JAM board priority.
Sharita has a question in the chat.
Okay.
Yeah. So what will it look like pushing this forward? I think one is we'll hopefully get Duke students looking at this across several areas to help us push the conversation forward, particularly with our local healthcare providers. Two, I think we need to really think about alignment across what others are doing. So let's not recreate the wheel. How might we already be doing this and not have to add a lot of capacity, but be able to join forces? So, Sharita, I'm also seeing you say health and housing work group under Partnership for Healthy Durham might be another place where folks are thinking about this.
I would just like to add that that health and housing work group is trying to figure out how they better partner and what their role is and what that looks like. The National Healthcare for the Homeless Council could actually they can do some TA assistance for us as well. And so I think that it's great if we can get students looking at this, but I think that they need to identify some places where they can get a lot of information faster so that they can take it to the next level. And so places like the National Healthcare for the Homeless Council, and they can be an asset and a resource to them to push the envelope, push our efforts further. So they won't have to like recreate everything. They can kind of tell us who are the places in the country that are comparable to us and what are they doing that we're not doing here. And I think you have to be clear on what the questions are going to be to the students, what resources are we going to lay before them to help them advance the conversation, because they don't need to like start from the beginning and do this. They need to be adding to the body so that we can expound and make some more tangible efforts quicker to give us better outcomes soon. And so making sure that we utilize our resources accordingly, but also trying to figure out if we push this forward as an HSAC, what is that going to look like? Are you calling the same conglomerate of people together? Is it going to be a whole new group of people trying to do this thing? Like, what is that going to look like, pushing it to the next level? Is there going to be some expectation of some tangible things that we're going to do, or are we going to give tasks to other entities to help us? Like, I'm just curious about what it looks like. If we push it forward, what does it look like?
Go ahead, Russ.
Just two things. One, in terms of the students, so we're talking specifically about just to clarify, a number of us have worked with these projects before. So we're talking Duke, Sanford, graduate students, many of whom have already had like real experience, like working in like Urban Institute and different, when we say student, I don't know what image we get in our head, but we've had very good experience with them meeting with us at the beginning. We give them the very kind of information you're talking about, Sharita, and it advances the conversation really quickly with baseline pieces. So we're just asking at policy pieces. And one of the things we've really enjoyed is if students are deeply interested in housing that may eventually be people making policy at a state or federal level, I mean, one of the people that led our first project is now running the guaranteed basic income project for the county 2 years ago. So it's folks engaged at that level. The other piece I was just going to say quickly is, in terms of Shrita, what you're saying of like, so how will this affect things? I'm hopeful that part of what this does is say, this keeps coming up. This is a priority, because I think one of the things we're trying to do as an HSAC is there's always like 40 things that we need to be focusing on, and a new piece of data comes and it's sort of like whack-a-mole, like which thing are we going to try and hit? And this hopefully helps us, at least for a moment, say, okay, this is a huge priority. And so in those moments when other things come up, we figure out when we can prioritize them or what energy we can give it, because this is such an all-encompassing piece, if that makes sense. Because it always feels like there's 40 things we could do on a any day.
I think so. All that sounds great, but I would definitely say that the policy can only be as representative as it can be of our continuum if we have participants taking advantage of it. And so one of the first points that I talked about was, how do we make sure that as homeless services providers, we're utilizing the resources that we have in our community already to their full extent. I can tell you right now, we're not seeing half the homeless people we should be seeing in this clinic. And most of our referrals, believe it or not, are coming from Durham. Most of the people that walk in the door, there are more Durham Rescue Mission people walking in our doors than people from next door or Housing for New Hope folks. In my mind, that's a problem, because we are the homeless healthcare provider, but people are not getting connected. I'm not getting calls during the day saying, Sharita, we got a person we need to get in and see a doctor. We think they're disabled. I get the call to say, Sharita, can you do a disability application for this person we believe is homeless, who doesn't have a healthcare connection? So, I think that we have to step the process out. How do we use our resources that we have in a more meaningful way? Number one. And then once we start doing that, where would we like to see it go? And so that's why I'm asking, like, what does that look like? Is it going to start small, or are we going to go all the way to policy when we're not, as a continuum, doing a good job at taking advantage of the resources that we have in our community? I hear what you're saying, but at every meeting I'm sitting in, I'm telling people that we're here and we exist. I'm saying the clinic is not open at 1 o'clock. I mean, at 8 o'clock, but I'm here at 8 o'clock. Like I said, I get a disability call before I get a call about a person needing to access care. And actually, if I'm going to help anybody with disability, they have to be our patient first. So you giving me the camel before you giving me the cart before I had a camel to pull it. So, I mean, I don't know if I've never had anybody say, Sharita, I want you to come talk again. I've never had anybody say, Sharita, can you send me a flyer? I've never said, I kind of always make people aware that we are here and, hey, we're waiting, willing, and ready to serve. And, and then I get the calls from Lincoln saying, hey, y'all not seeing enough new patients. And I'm like, but our numbers are growing. So that just doesn't make sense to me. So why are people not coming to the door? So, not to get us off on a tangent, I just feel like we don't, like you said, packaging. It's so many pieces to that packaging. We're not doing as good of a job as we can. There are communities that don't have an HCH. A lot of them in the state of North Carolina. How do we utilize that resource? How do we get the clinic to be open more hours? We increase the demand. So all I'm saying is we need to make sure that we're working with the assets that we have in our community in a meaningful way, so that we can have ammunition to go back to Duke and say, hey, this is what we're doing, and we still have XYZ needs, so that we can push the envelope to the next level. So that's all I'm saying. I'm just curious on what it's gonna look like. Is it gonna just be this straight policy thing, or are we gonna be tangibly doing some things on both sides? You know, from a service provider standpoint, accessing for their clients to the policies in the communities that we need that support people's health needs. Where will this initiative live, like, and what will it do? That's my question.
So it's a great question, Sharita. And when Eliza and I were talking about it, the goal of this is to try and define the problem, define the scope. And until we can figure out what exactly are we looking at, how many people are we looking at, what specifically or what overarching categories are people falling into? Are we finding a whole bunch of 50-year-olds who need assisted living? Are we finding a whole bunch of 75-year-olds amputees that need group homes? You know, so many different things in this spectrum that this is our chance to try and define the problem. Let's define the problem, not the way that we see it, looking at just aggregate data in an HMIS that doesn't get down to some of these levels, but really sort of talking to, hey, Duke, hey, VA, how are your discharges looking? Who's being discharged to homelessness from your side? Hey, coordinated entry, who's coming into the homeless system that falls into these categories? Urban ministries, families moving forward, who's in your shelter that you feel are unable to be met? What does that look like? And once we can define what the challenges are, what the problems are, then we start saying, okay, what is the solution? What would it take to solve for this group of folks who, just making up an example, here's somebody who needs an assisted living facility, but there's no Medicaid assisted living beds available. So does that person have to be literally unsheltered because the homeless system is not equipped to be an assisted living facility? Or is there another option? And what would that look like? Does it mean you need an assisted living facility for people experiencing homelessness who have Medicaid, but there's no Medicaid beds, or don't have Medicaid, or have Medicare, or have anything? How do you take care of that group of people? What would it look like? What would that cost be? And then the goal is putting that together and then saying, all right, this is the challenge. This is the scope of it. Then coming back to city council, county commissioners, Duke, VA, all of the, to Lincoln, all the providers, getting them around the table and saying, we've got a problem of X people fitting this demographic with these needs that the homeless system is unable to meet. The medical community, as of now, is not able to meet the needs of this group of people. We need to, as a community, come together and figure out who's going to do what. Or are we as a community saying, you know what, we really don't care about this group of people. We as a community are not going to do anything different than what we're currently doing, and we're going to let them slip through the crack. Go and make a recommendation until we know what that problem looks like and what possible solutions would look like, along with possible costs. So I think our hope is at the end of this, we would be able to have a formal request coming out to all the stakeholders saying, here's the problem, here's the solution, here's the cost. How do we make it work? Does that help?
Russ, go ahead.
I fully support what Colin's saying, and I just want to distinguish, like, this little group of students
Yeah.
is doing
Yes.
one tiny aspect of, like, you know,
Yeah.
Shrita, you said something in last meeting, because I was reading through the minutes, about, like, we're the group that something to this effect. We're the group that should be taking lead on X, Y, or Z. I can't remember what it was. And I thought, yes, that's true, but we are not organized to deliver on any of those things at this point. That's part of what we're trying to deal with here. Is we have lots of great discussions, but it's very hard to get down to focus, to dig deep and get information, and then know how we tackle what we're trying to focus on. And so there's this initiative around this piece, that a big picture thing. I think the discussion is all really helpful. When we're talking about this one group of students, and yes, I saw Anthony's question, like, other students can be involved at some point. this is just a specific project that they're available to do. Instead of it just being H&H doing it, I kind of asked others if they wanted to be involved. And we've had great success with it, just to get a baseline of information of how are other communities doing this. We're not talking about implementation. I want to know how other health systems are engaging. How are other COCs organized? Because I don't know that we're getting the results we want, and we need to know if part of it is how we're structured. That's it, if that makes sense for that student piece. The whole initiative piece, like I do not expect Duke grad students, capable as they are, to come up with all the implementation answers. I just need to know, what does a skeletal infrastructure look like for some of the decision making and getting people to the table. Because I mean, I hear your frustrations. Obviously, Sharita, Sally has the same at different times of like, no one's like tapping into you all. We've got to figure out why that's not no one, but I mean, not enough. What's going on there? How do we get that information and just get ourselves all to a different place as the situation, the community is changing, and we're trying to kind of pull back from how we were structured maybe 15 years ago or 10 years ago to respond to the growing needs we've got now for changing.
Thanks, Russ and Colin. I think what I'm reflecting on is when I mentioned the grad student piece, it seemed like that became the focus, which Russ is totally right. It's a very small piece of this larger picture. So if we move this forward, I can imagine presenting it just more in the vein of what Colin shared, since that student piece is like a subset of that larger work. Any other thoughts? Do we want to continue? We had a motion, we had a second. Are we ready to vote? Any other thoughts? Okay, to remind us, the motion was to bring forward the Jamboard priority that we've been discussing to the full HSAC in our next meeting. We had a motion from Jonathan, a second from Russ. So please, I'm not hearing from anyone else, please vote in the chat. Sharita, I'm seeing your comment with concerns. Okay. As in, the concerns are what you addressed in terms of how are we clear about what we're going to do and how we're going to do it.
I think that the Jamboard speaks for itself. It's a little heartbreaking to hear the jam as a healthcare provider for homeless persons. It's a little heartbreaking to hear that as the concern. Who's been here and been present and pushing a lot for people to be connected. But like I'm concerned, but I'm pretty sure I'll share my opinions at every opportunity I get to share it. I think that's all I can do.
Yeah. Thank you, Sharita. We appreciate you always bringing your voice forward. Important contribution. All right, so we voted to move the recommendation forward and offer an update on the Jamboard work to our full HSAC, so we can put that on the agenda for our next meeting. Next on our agenda is the calendar for the year review check-in. So last meeting, Colin and the team had created a calendar for us to look at and of what's happening throughout the year. And we said that we would look at it again this meeting to just refresh ourselves and also see if things have come up that need to be added. So Colin, I'll pass it off to you.
And I'm going to ask Mr. Henderson if he
Yeah.
can pull up the calendar, because he has been the expert calendar maker. Oh,
I'm sorry,
sorry,
Colin.
that's right. That's right. Is it in SharePoint or is it on your personal
It's
computer?
actually on mine, and I don't know if I can access it from here. So I apologize about
That's
that.
okay.
I may just have to send it.
Let me see if I can find a link from, because I think you sent me it at one point. Let me
I
see.
did. It has updated some just with some information Lloyd and I have been working on.
But if it's in the same link, I might be able to get to it still. Let me see what I can do. Eliza, let's move on to the next agenda item, and we might table this.
Sure. And if you're looking for that, our next one is the county commissioner request. Should I jump from that one too? Or are you good to talk while you look?
I can talk and look.
Okay. I'm not as good at multitasking, so I had to jump in. Okay, so following our last full HSAC meeting, we, Colin and I got an email from, why am I blanking? Can you remind me, Colin, who the email was from?
Shannon Trapp,
Thank you.
the chief of staff
Thank you.
of the county.
Yes. They were looking for an HSAC update to occur on December 12th during the joint city county meeting. We didn't get a lot of information about what they were looking for, if it was an HSAC update truly or a state of homelessness type update. So it sounded like it was more the latter from conversations that Colin had. So wanted to make sure the group was aware and allowed Colin some time to update us on, what he's thinking and what information he got that they're looking for. Also, just want to note that that is the same day that DCIA has requested a secondary presentation. So there was one that happened over Zoom yesterday that Colin and Sharita and Nicole were, I believe I'm getting everyone right, were there and present for. It was more of just like recording so that people could watch it in the future, as there was a lot of, and Ebony, thank you. Ebony was also there. Recording so that the faith communities could see it later and have a call to action. And so this on December 12th is assembly in person. So those are two things that are happening on the same day. We can start with the county commissioner request and then just see, what we have capacity for from there. I've talked to Bree Van Velzen from DCIA, and Bree is, open to shifting if we need to for DCIA, and I'll be in touch with Bree. Colin.
Yes, ma'am. So the request is as Eliza said, to make a presentation to the joint city council county commissioners meeting on the 12th. And the request is really to do a state of homelessness, which is kind of looking at the data, looking at what's happened over the last year, challenges and things that are moving forward. And at this point, we can put that proposal together. Eliza and I've talked a little bit about it and suggested that, or kind of thinking at this point, since she's chair of the HSAC, letting her speak about what the HSAC's goals are, for the year that we're kind of in/wrapping up in the next 6 months. And then I would take all the wonky data stuff about what's happening overall in the system, the challenges that we're seeing. It should be a pretty straightforward update presentation.
I'll just add from my end, I think it's a great time thinking about the budget cycle to bring back up what we voted on last year and present it, I believe, just to city council on here are our highlight asks. I think it would be great to bring that up, and would really, rely on Jonathan and Sharita if there are specific updates do you want me to bring to the forefront about our committees. If y'all could help me highlight those correctly. But I see like my contributions, I think, are an opportunity to bring some of those trends and highlight what we were asked previously around if we could have anything with any budget, what would that look like? Bring that up again to them. So it's on their minds as they're thinking about the budget cycle as it starts up again.
Do we know if we can, Urban Ministries is doing an update on the project they're working on, I think in preparation for a likely RFP, at least for some additional funding towards moving things forward. Is there any way we could nudge to go before Urban Ministries so it felt a little bit like, here's the challenges, and oh, by the way, a solution's coming down the road? That's one question. And then the other is just, would it be good for us to let 12-1. So this is kind of all happening in between HSAC meetings. It may be good for us to just let the rest of the HSAC know that it's happening, because it may kind of reinforce the, I think we've been hopeful we could get more back to an advisory role, and just let them know in case some people could even sit in or whatever. I mean, I know a number of us are going to be there because of the Urban Ministries piece, so you'll probably already have a backup choir sitting there. So.
My suspicion is that's why we're being asked on the 12th. I don't know that for sure, but I think you make a really good point, Russ, in terms of doing the state of homelessness ahead of the Urban Ministries would make sense. I'm not the agenda planner, but I can definitely reach out to Shannon, who is working with the agenda planner, to sort of suggest how to order things if they have not already thought that through, but they probably have.
And we probably should be thinking too, I mean, we're going to have 2 new city council members there. Where in one case they've been one person's been very involved over the years around these issues. I'm not as clear with the other person. So just, I think in our preparing and presenting, just mindful that we've got new folks that we're kind of orienting to the work.
Right, because our seat
on the radar.
Our city seat will be open, right, on HSAC. Our city council seat.
Yes. Well,
right.
Yeah.
Technically it's Mark Anthony Middleton is the primary on the city council seat. And
I think it's Hosley Hyman who's our primary.
That's not what the city manager's office told me.
She's on the site.
She is.
We saw something else in writing that made us think it was Hosley Hyman, but I think it's 2 different things in 2 different places.
I think you're right on that. I think there is according to the city manager's office, Mark Anthony Middleton is the primary and Hosley Hyman is the secondary. But I think at the time we did this, and it switched at some point. At one point it was Hosley Hyman, then Middleton, then they switched it. But I think we messed it up somewhere along the way. But either way, it's time to update it.
Okay. Yeah, and it's on my radar to catch Leonardo sometime soon, to make sure that he's also aware. And I have met with Heidi Carter, and she shared that this is her last term. So that's another thing to keep in mind as election cycles start up, that Commissioner Carter has been such a champion for this work. And what does that look like moving forward? And that will most likely impact the next chair, but I think it's certainly something we can plant some seeds for now, to make sure folks are thinking about us and making sure their engagement with us continues. So any other questions, thoughts around the 12th? I heard a recommendation to make sure that the full HSAC knows that that's happening. The other piece that I think would be helpful for the full HSAC as a reminder is that our meeting again is early in December, and it took folks a minute to get on longer than usual in our November meeting. So maybe we can send out a reminder that does both. Says, hey, our meeting is early this month, and also this is happening on the 12th. Is that something that your team can do, Colin? Or okay, seeing Melissa say thumbs up. Great. Thanks, Melissa. Let me know if I can tag team with you in any way that's helpful on that. As for the DCIA request on the 12th, is there anything else that we should know about that?
I didn't know if you needed anything from us. I think I asked this question in our meeting the other day. I didn't know if you were going to represent some of the information from that session or not. Initially we were hoping that was going to be a convening of people live attending that Zoom, and it didn't happen. So that's why I ended up just being a video, which is very heartbreaking to me. So I didn't know like what your plan was, or if you wanted backup or somebody else there or anything like that.
Yeah. To be honest, I have very little background. I found out at that meeting the day before, and then Bree and I had a coffee about the homeless memorial in the morning, and so that's when I really decided to hop on to the call. So it sounds like, Sharita, you have more background. I don't need to be the one, and I would prefer not to be the one presenting. I don't think I know this content as well as you do. I'm happy to be there if I'm able. I think with the presentation in the morning, I'm just curious about how that will turn out in terms of timing. But I think I'm not clear on the ask, and it sounds like you're more clear on the ask than I am, Sharita.
I don't know. What time is that meeting on the 12th? The DCI is in the afternoon. It's in the evening, right?
I think it was like lunch, like 11:30, I think.
Okay.
And we're not sure where yet either, so there will be commute time. So that's the piece where I'm like, I'm just not sure if it's the best day, but I also don't want to. Russ, I'm seeing your hand. I'm seeing your hand, Russ.
So the clergy part of me, all kind of alarm bells are going off. We do not want to present in December. While DCIA is an interfaith group, it is majority Christian, and all those leaders are trying to get through Advent and Christmas. Everything's crazy right now. If they're there, they're being polite and showing up. They're not going to absorb anything. So,
but did they ask Eliza? Like, how did it come up for the December the 12th meeting?
I don't know how did this meeting that just happened? How did this meeting that just happened come up? Like, I don't know that either. So
the meeting that we had a meeting in October, a policy and planning meeting in October when the numbers ballooned crazy, like right before White Flag started, and we were freaking out, and we decided that we wanted to do another appeal like we did last year for families. Because we had so many, the number for families was crazy. It's still crazy. It's still 42 families reporting literal homeless right now there in Durham. And so we just reached out. I reached out to both DCIA and the IMA just to ask when a good time for conversation was. IMA didn't respond, Russ, and DCIA did. And then they asked us, once we had a call with Brianna, she asked us to present. And we picked that date in November. Like, that's how that happened. That happened strictly in response to our literal homeless crisis here in Durham County. So that's but then I kind of just heard about the meeting with Brianna in December, but I wasn't aware. I wasn't aware that they were asking for that update or anything like that. I mean, I literally found out when we were having the meeting that was coming up. So I didn't know what we needed to do. What I do know is on the 12th, I'm probably not going to be available any of that day because I will probably be at the hospital with Zuri all day. So I am not available. So I don't know if any of the lead agency staff, Colin or Anthony are available to do that if you feel like you need support, Eliza, or what. I just wanted to, we do have a whole PowerPoint that was already done. We still have this very present need for options for people right now because it's cold. We thought it might be a good opportunity to maybe bring it up again, especially if there's an audience. But at the same time, Russ, I hear your concerns, but I don't know where the December suggestion came from as far as DCIA is concerned.
I met with her yesterday to plan for the memorial service, and we got talking about it. And I think she's just somebody who's very concerned and sympathetic and empathetic and wants to create the space. She is so flexible about when the space is made. Because I even talked to her. I mean, I'm kind of separating the kind of immediate piece you're talking about from just overall system, what's going on. And I said, we could do something even later in the year when like after pit count or around, when we'd have some of that information and data. But getting the requests out that you're talking about, I mean, I think part of what we may need to do is make sure there's some providers there, because otherwise, like if it's just city staff, I'm not sure they're equipped to respond to churches saying, hey, I want something to do. I mean, those of us that work on that all the time, there's very nuanced ways that you have to work with faith communities, because they tend to want plug and play options. So
Russ, you're absolutely right. City staff is not the one to be making the ask of the congregations. We were only there to present the data and the background information and how the system is currently operating, and then sort of tee it up for those who are doing the work to make the pitch. Here are some ways that you can step in and help during this cold weather season. The invitation from the 12th was kind of an out of the blue thing that Brianna sent to us saying, hey, I hope you can join us on the 12th, which I think was she may have known that there was going to be the meeting we had the other day was phase 1. And then phase 2 would be in person or virtual with perhaps more robust conversation or a formal request. And I don't think we had any, maybe 1 or 2 people came to the meeting that we just did. So I think this was just kind of a follow-up. And Russ, to your point, yeah, it's Advent season. It's going to be tough for congregations. It may be better for us to do this in January or February, which isn't going to help us with the current cold weather season. However, because we are at Advent, this may be a great opportunity to have a second collection, for lack of a better term, of during those services when it's cold outside, and who slept in a manger. We don't need people in mangers in Durham.
Yeah, everybody's holiday asks are pretty much already set at this point.
Okay.
Newsletters are going out and it's December 1st. But that's, I mean, other than a special, so I think you're right. I mean, if we can get January would not be a bad time if she was open to that. And we can get some of the providers there to as backup and for there to be direction for the asks.
Okay, so I'm hearing let's shift to January, and then that also gives us time to get providers there. And maybe it's not a full redo of what was just done over Zoom, but a summary, and then allowing more time for the connection to providers to say, here are some possibilities of ways you can contribute and support. So, Colin, did you get an email from Bree about December piece? Do you want me to follow up? I just wasn't on that email.
The only thing I got was, hope you can join us at this meeting. But
okay, so I will follow up.
So I think it's just following up and what is it that she would like, or what is she, or,
sure.
Or hold on, I think Bree doesn't use pronouns. So what is Bree wanting us to do?
Right. Great. So I will send an email follow up and include you, Colin, Sharita. I will also include you. I'll include Ebony because Ebony was at that meeting. Anyone else I should include on that follow-up?
Yeah, I was at the meeting for entry point.
Yep, I was getting ready to say your name, Nicole.
Thank you.
Yes. Thank
Just
you.
because,
Thanks,
and
Nicole.
the big thing is community development can't do the ask. The ask has to be made by somebody else. We do have mechanisms for VOA to receive funds if funds is something folks want to offer, and the same thing with Durham Public Schools. So those are our
Great.
two kind of where resources will go, where they will branch off and go. I did get one call from a Duke University, the school affiliate, who is going to try to do a sleeping bag and blanket drive. Colin, I don't know where that needs to go once they dump it all on me.
What do you mean?
But I did get that response. I don't know if it needs to go to Russ or if it needs to go to Russ and Hart.
About what?
They're gonna do a
bags and
sleeping
blankets?
bag and blanket drive. I don't know if it needs to like give it to Street Outreach and Heart team. It's probably, but I'm waiting. So the person said they were gonna start the initiative for the month of December and would be back in touch with me.
I would say street outreach.
Yeah, we've got some storage space because those empowerment blankets we got 3 years ago are finally about out.
Well, I'm hoping we
Empowerment
get
jackets, excuse
sleeping
me.
bags and blankets, and and as soon as she lets me know that she has them, then I'll let you know, and you can tell me what I need to do with them.
Great. Sharita, if you don't mind offline sharing whatever department this is at Duke or group, it's just helpful for me to know with my Duke hat on as we think about, Duke will often have separate folks doing things that don't know about other people. And that is the work of our office to try to get them to work more together and potentially have greater impact with whatever contributions they're thinking about. So that'd be helpful. Thank you. All right, so I will follow up with that email, and it sounds like we will send Melissa will help us send an email to the full HSAC sharing about the December 12th joint city-county presentation, as well as a reminder that our December meeting will be earlier this week. All right, we have about 25 minutes left. I've got to pop off a little bit earlier than 11:30. I've got a doctor's appointment. So we can jump back to calendar, Colin, if you've got that.
I do have it.
I think we should be able to set the agenda pretty quickly. I'm hoping.
Well,
we can do that after.
I don't know if the calendar is that critical. I think getting the agenda set is more important.
So let's do that first, and
So
then
let's
jump
do
to
the
calendar.
agenda, and then if there's time, we could do the calendar. I don't think there's anything on the calendar that we need to necessarily be completely aware of right now.
Sure.
Let me pull this up.
While he's pulling that up, we received an email, not for this month, but there's an ask from the Early Childhood Homeless Task Force to do a presentation to HSAC in February. They're asking for about 30 minutes. So if we can just put that under February and think about if that's possible, I think it would be really helpful to get that update from them. And I may loop to them before to see if there's anything we can include in this December 12th meeting. Russ, did you want to share something?
I was going to say, I was chatting with Tasha because I remember isn't that the retreat day?
Oh, you're right. February is.
And just to check if it mattered either way time-wise, and I've been somewhat involved with them. It's flexible, based on, because I was like, if everybody's been out touring or whatever and is worn out, you may not want to be the tack on at the end of the day. And so they're flexible. They were just kind of randomly picking February.
Got it. I think it's timely though, as we're seeing a lot more increasing family homelessness. So
yeah,
I think whatever they have to share, I think will be very relevant.
I see in the chat from Sharita, the numbers you were asking, you're talking about the unsheltered numbers of keeping that updated for December 12th, or?
I was saying, could we at least give Brianna a update on the numbers since the presentation to let them know whether the numbers were growing or not, just as something that she could mention as a follow-up from at least the video presentation that we did. Could we just give her an update, since it sounds like we're gonna move from meeting with them on the 12th until January, right? So I'm just
Yeah,
wondering, we could just give them like an update of the numbers, like close to that day, just so they kind of know where we are since that time. And maybe it might, prick some folks to try to do something over the holidays and things like that, to maybe help with this, with our need right now.
yes, definitely.
Alan.
All right, so I pulled up sort of our agenda planning document. An executive committee went last time, so I think it's performance management, so it's got to be policy and planning is up. Does it sound right? We got a policy and planning update. The rest of these were just kind of ideas of things to put in. The two, and I got to check with Jeff and Anthony, make sure and Melissa might know, but I believe we are on track for these two items down here to be approved. Grievance policy and coordinated entry policies and procedures, which have been updated to better reflect how the system is operating and to create some balance in the system.
I can double check with Jeff about the coordinated entry policies, but Anthony did send an update this week, and it's he's made so much progress on that policy that I would expect for it to be ready. So I think the plan would be the Monday before our full HSAC meeting. That's when policy and planning will approve the recommended policy updates, and then assuming that policy and planning accepts the policy updates, then that would be presented that Wednesday for to the full HSAC.
So I think those two items have to be on there, at least one of them. And coordinated entry is, talking to Jeff yesterday, is definitely close, if not completely ready. But I think his goal is to have it done. Then so that's at least 30 to 40 minutes of that. We had talked about possibly a housing bond update, a Medicaid expansion, or populations to watch and plan for. And
Is UMD, I know that they wanted to not be last month. Did they give a reflection on when they want to do a presentation? Did they want to bump from last month to this month, or we're not sure?
Let me check and see. Hold on, let me go back. I can't remember from Sheldon and I were texting about it, and I don't remember from last month what he said. Good memory, Eliza.
Just looking at my notes is the only way I can remember things.
They should have a presentation ready to roll by then.
It'll be practice. Well, no, it'll be post practice.
I know that when he sent the initial email about wanting to delay, he didn't give an official month that he wanted to present. So I don't know if you want to offer January, Colin.
Yeah, give me a second.
Just because if he's not ready, this is an early December meeting, so I don't know if it's a quick turnaround.
Good point.
Yeah, he didn't have anything in his email, so I'll put it down there, and that would make sense. So we'll do UMD presentation if UMD is available. If not, do we want to do sort of these populations to watch, which is similar to what's being presented to city, county commissioners? Because some people on there will have already heard it. and I'm not saying do the exact same presentation, but a piece of it to talk about, trends and things. Do we, do we need to talk about the piece that we just voted on, the healthcare? Or the vulnerable, which I think falls in that populations to watch and plan for.
I'm curious if the housing bond piece needs to come before the populations to watch.
I don't know that the housing bond piece necessarily has to be in there. These are things that are just sort of here as parking lot, so we don't forget that we want to cover them.
Sure.
They don't have to be done in December. They could be done in January. And I don't know what Reginald and Matt Walker's schedules are to be able to do this month.
Okay.
So the housing bond may be better to do in January.
I do have an item potentially to add for December. So Lloyd and I have been corresponding back and forth, and we've been within performance management working on steps to do a housing first evaluation for next year's COC application. And we're going to need a chunk of volunteers to help us do that. And so he and I discussed possibly maybe making an announcement at the December meeting calling for volunteers.
I wonder if we also need to do something on pit count. Because this will be the last one before the, if I'm not mistaken, this is the last one before the pit count, or the other one may be like a week away.
Yeah. I think you're right, Russ.
Given that, I think it would make sense to just go ahead and plan for housing bond to be in January. And even UMD's presentation, I think we just offer Sheldon January. Just because so far what we have up there, I think is going to go over the amount of time that we have. We did also promise an update on the discussion. It doesn't need to be long, but we offered an update on the discussion involving involvement on committees, because we had some people who said that they didn't fully understand, how they could participate in the standing committee. So I think we also offered like a quick update, and that could even be just 5 minutes explaining how someone can participate on a committee,
And
including
was there
TSC members.
Was there a survey too? So we need the survey results from that, right?
Yes, the survey results are basically the same. I think we got 2 additional responses that I sent to Eliza, and the comments were like none, like they had no comments. So essentially the results are basically the same.
And I am seeing that email, so I'm happy to forward that along to exec in a email after. But if I haven't had a chance to look at it yet, but I do think it could make sense to start with that very basic piece, because that was really clear in the results that we showed live in our last meeting that some folks were just confused about. And then also the piece around like that the meetings can change times, I think is new to folks. And I think that would be really good to indicate. It's like, we don't have to have these meetings at these times. So if you're interested, let us know and let's see how we can be flexible.
All right, so policy and planning update. We'll do the approval of the policies and procedures. If coordinated entry isn't ready, we'll bump that to January, but I'm pretty sure that's going to be ready. Subcommittee survey, jam board priority for the year, housing first evaluation, recruitment update, and pit count update. That's probably a full meeting. And then some. And we might be able to do the subcommittee update, recruitment, and housing first evaluation, kind of tie those two together, because they kind of go together.
And we may even want, I mean, I'm wondering what further work we need to do on kind of the Jamboard priority for the year,
That's
because
exactly what I was gonna
we
say.
had some real confusion,
Yeah.
and we may need to get that. We may need to articulate that better, even among this group, before we make it live.
Okay, so move that to January.
Yeah.
Yeah,
I think that would be good. And also January's the new year, so I think it could time out nicely. But I agree, Russ. I was gonna say it sounded like even though we are saying yes, let's move this forward, there's some work that I can do, we can do to clarify and be specific before bringing it to the larger group.
yeah. And that Medicaid piece that's on there, when I mention Ann and Fred, I'm meaning for like the Medicaid transformation where you're able to use the money for a lot of other things. I think Medicaid expansion is more what Sharita tends to raise. That's just like happening today, which we need awareness of. So I'm actually bringing Fred and Ann into meetings at the agents at H&H. So I'll have a sense from them. I'm going to have them present on this just internally. And I think after they do that, I can bring back more info on what may be helpful for the broad, whether it's for the full group or if it's something like planning and policy needs to look at or this or whatever.
Sharita?
I just wanted to add just a tidbit to that statement that you just made, Russ.
Mhm.
So anybody in your programs that have that family planning Medicaid, they should have already gotten their letters.
Yes, the
This
emails
is very
been circulated in
important.
the agency. Yes.
But if they have United Healthcare as the auto assigned provider, Duke and Lincoln do not take United Healthcare. So the request to change their insurance to one of the other insurances needs to happen as soon as possible, or they will not have an acceptable insurance in Durham.
Mm.
Okay.
I will probably connect you by email to folks who are more useful with that. You can tell me stuff, but I'm not going to get it far. I'll connect you by email with Shantae today.
Okay.
Yeah, because it's gone out among the staff, but not that piece, and that's critical. Right.
Just a quick side note for me, since I'll have to make the agenda, if you guys could just give like estimates for how much time you need for some of the remaining items and who is expected to present it, just so that it speeds up the agenda process a little bit.
Thanks for that reminder, Melissa.
Yeah, I mean, the
So
Melissa would know the recruitment survey stuff. Housing first evaluation, Jonathan Lloyd, do you have a rough estimate what you think that might take?
No more than 5 minutes, I wouldn't think.
Yeah, I 5 minutes should be fine. I mean, I basically will kind of be explaining, why this is important, and I think 5 minutes be fine.
Okay.
I personally would separate the two items only because I don't want people to get confused with what we're asking for the involvement survey with the housing first evaluation survey, because we want people to volunteer for the housing first evaluation committee. And I don't want them to think they've already done the survey.
yeah, good point. And the subcommittee survey recruitment is almost responding more like information more than an ask. I don't want to do back-to-back asks. I think we should focus our ask on the housing first evaluation recruitment.
I'm happy to report that we've already got 6 HSAC
Great.
members who have volunteered. Thanks, Eliza, for accepting the invitation.
Sure.
And 5 others as well. Russ, you're off the hook on this one since we're evaluating your projects.
What about pick count update? How much time?
5 to 10, and Shantae can do it. Unless there's something time-wise I'm missing, but I can't imagine more than that.
We'll put 15 minutes because I'm sure there'll be questions and people want to know what they can do or how to do it.
And then policy and planning update, 5 minutes. This is what I saw in the chat from Sharita.
45 and subcommittee recruitment. Melissa, well, that's, do we need any discussion on that? Is that 5 minutes, 10 minutes?
I think we could do like 5 minutes. I guess we could do 10 actually, just to allow for questions if people still need additional clarification. Because I do want to encourage people to ask those questions there rather than wait for a meeting 6 months from now and tell us they still don't understand what's needed.
Pretty full meeting. We'll keep it. That'll look good to everyone. It's got a little bit of wiggle room in there that we can use if we need it.
And it's December, I think.
Mhm.
Overloading people with information in December. I know for myself, it gets harder to listen.
Good point. Good point. Good point.
Yeah.
Fantastic.
Great.
Looks like a plan.
Yeah.
Russ, did you have something else you wanted to say?
I'm trying not to go too far down this road. On the January piece about housing bond update, and I may sound like a broken record on this.
Mhm.
How do we, okay, I'm going to see if I can tie these threads together because I think this is one of the sets of threads we need to pull together. We have a family housing crisis, right?
Mhm.
Over here on the far end, there's a bunch of new housing that's in process. Some percentage of that housing is set aside for people within the populations we serve. We are not entirely clear how many units, what levels, all those pieces. The other connector in the middle there is that there's rapid rehousing funding, which isn't always able to be spent out because those of us doing it get caught in this place of like, there's a whole bunch of folks we could put into housing. I mean, we just got 6 new units yesterday. We could put into housing very quickly. But then if they're not able to, take their income from very small to 60,000 a year in the next 24 months, then there's going to be angst on the end when that happens. I'm seeing Shrita. Shrita, you're my one. I'm like, Shrita's either going to holler at me on the head end or the tail end. We just got to choose which one.
Mhm.
And justifiably. It happens. And so part of me is trying to think, like, I'm not sure it's coming out right, is a lot of times we're going to go in and be like, okay, this is going on. Or this is like, there's these needs, or there's this housing. How do we create the conversation or a work group or something that gets together and goes, these properties are coming available. It's going to have these money set aside. This is what it's going to take for people to be there. And possibly right now we could use some rapid rehousing. And I'm looking specifically even to like H&H is a party to the Hardy Street project, right? Like I just reviewed the letter yesterday from 3 or 4 years ago. And it has like they're going to take referrals from within our community and it's coming through H&H, potentially some supportive services. But we as a system need to know what those numbers are. So I'm trying to drive to like a housing bond update. Fine. We need to know specifics. This property is coming up at this point and it has this many units in it. It's targeted for this date to get up and running. Okay, what does that mean for the not just families, but particularly families in this case? Am I preaching to the choir, Sharita? Okay.
Yeah, I think what I would just add to that is the units that are coming online, the development timeline consistently shifts and it's hard to keep up with that. And so I think a lot of these projects received LIHTC or LIHTC projects that received funding from the city or the county, and they have shifting timelines, and that can get really tricky to understand when they're going to be coming online. And so that's just another component, I think, of the conversation as we're talking about when things are expected and how that shifts. It becomes less of a shifting timeline, I've heard, once people break ground. But getting to breaking ground is hard.
And I mean, I think there's ways to even house some of the info within the landlord engagement project potentially, because it's new units coming. I mean, there may be some way to do that if we need to, but I just don't know how we have that conversation in a helpful way, because it's like there's this potentially a solution, set of solutions in there. I'm oversimplifying it, but we got to figure, I don't know where the conversation happens to try and map. Yes.
I call it asset coordination. That's what I
No, it's
call
real.
it.
Yeah. Well, because even the rapid rehousing thing I mentioned is real. Lloyd and I've had this conversation a couple of times. I'm like, when do we want to be hollered at? At which end of the spectrum? Sharita's voice in my head.
That's the problem with rapid rehousing. It's rent reasonable and fair market rent, but you got to make sure it's rent reasonable that the client is going to be able to afford it in a reasonable amount of time. And you have never paid $2,000 a month in rent, and you've never made more than $1,000 a month in your lifetime, it's highly unlikely you're going to afford $2,000 a month in rent in 24 months.
Right.
Not to say it's impossible, but statistically speaking, it's a pretty heavy lift.
Yeah. And honestly, with some of these units coming on board, the property management would appreciate an easier timeline and things being coordinated for those like 30 and 50% units. That's generally a rule. People appreciate that coordination. So, you know. Anyway, I wasn't trying to derail everything, and I know you got to drop in the middle of it, but I just don't know how we can find a way to pull all that, start pulling those pieces together. Because an update will be fine, but we need like really nitty gritty detail to help us think through how the system's working.
Yeah. I do need to drop. I'm curious, Colin, are we able to continue the meeting if I'm dropped? Because normally I would hand off over to Ebony.
I don't know that there's like 5 minutes left. I don't know if there's anything else really that we need to get to. And Russ and I've got a meeting at 12 that we need to get to.
Yeah.
Okay.
Do we need, just sorry, I'm not trying to see how much I can talk, but if I still heard that. What am I trying to say? The retreat in February, do we need to try and get some planning done on that this month? I mean, not today, but do we need to get together for another meeting to try and get some of that coordinated?
We probably should. Thanks for putting that back on the radar, Russ.
Sorry, I'm full of sunshine and extra projects today.
Yeah. Melissa, can you make a note for us to sort of think some of that through and figure out next steps to recommend back to Eliza, Russ, and the gang?
You got it.
All right. Sorry, everybody. I'm having to end us abruptly today. Thanks for your patience with me. I think it was a great discussion. And the items that were at the end of the agenda, I'll send out via email that are just mini updates from me. And we'll get to the calendar next time. So I'll take a motion to adjourn.
Sounds good.
I move that we adjourn. I put the answer to your question, Eliza, in the chat.
Thank you. I'll see if I can track down anybody.
I second it.
Thank you, Jonathan, for the second, and we'll see you in the new year as the executive group.
Thanks,
Bye,
everyone.
everybody.